including giving of medical advice. There's no patient intended to be a substitute for personalized medical advice. If you have any issues, I do advise that you seek your own healthcare provider's advice, and don't delay in seeking any advice for any condition that you might have questions on. As far as financial stuff, nobody has given me any money whatsoever to do this presentation. I simply do this because I enjoy talking to you guys, and you know, I'm quite passionate about exercise in general. A little bit about me. I got my bachelor's of science from UNLV in 2010 as a pre-med. Then I went to Toro University in Nevada for medical school. That's a DO school out here in Henderson. Then I did my family medicine residency at Valley Hospital downtown, and then where I was also the chief resident in my final year from 2017 to 2018. Then directly out of my family medicine residency, I went and did a 1-year specialized training in primary care sports medicine. So this is non-operative care of an active population. I got a wife, I got 2 kids now, a 7-day-old and a 3-year-old. I got 2 dogs and a boat. In my opinion, okay, the real reason when you dig down to the root of all of this, right, is to stay healthy. And why do we want to be healthy? In my personal opinion, this is just my bias, the reason we need to be healthy is for others, right? We need to be there for our family, for our friends, for our loved ones, and to have really cool things like this boat here. This is not my boat. That's a $750,000 boat, but it looks good, so we added it. But here on the left is our newborn. His name's Levi. Here is my grandmother with our newborn son. And like I said, this is really the reason, in my opinion, why you should be healthy and exercise. So current titles I hold, I'm assistant professor of family and community medicine within the Division of Sports Medicine at UNLV. I help direct the primary care sports medicine fellowship that I graduated from. I'm also a team physician for the Las Vegas Aviators, which is the AAA baseball team, also a team physician for the newly formed Henderson Silver Knights, and a backup physician for the Vegas Golden Knights, board certified in family medicine and sports medicine. Okay, so let's talk about what we're going to learn today. So really, it's more important, I find, for people to understand why they should do something. And just rotely being told to do something is useless. We all have our opinions, and usually they're contradictory, and we go our own route. But if you're to understand and really embrace the reason to do something, or not to do something for that matter, you're much more likely to stick to it. So we're going to talk about the effects cardiovascular exercise has on, quote, aging. And how cardiovascular exercise affects those aging-related diseases. Very importantly, we're going to talk about the risk of not exercising, okay? And then we're going to talk about the risk of exercising. How to start exercising if you're not active currently, and how to improve your cardiovascular exercise if you are currently exercising. And then last but not least, it's important to consider medications that interact with exercise. This woman that you see here crossing the finish line, that's Bobby Greenberg. She didn't start doing cardiovascular exercise, so she was in her 50s. In this picture, she's 74, and she's crossing the finish line at Kona's Ironman, the full-length Ironman, where she currently holds the world record for her age group. So 74 and still kicking butt in Ironmans. Definitely faster than I'd ever do it. Okay, so let's talk about aging, right? You can't avoid it. There's no stopping aging, and nobody's immortal, nor do I think anyone should ever be immortal, but that's personal. But can it be slowed? More and more, the evidence is saying, yes, you can slow the process of aging, and you can slow the onset of chronic disease that occurs with aging. The inevitable decline begins somewhere in somebody's 40s, right? But not everybody declines at the same rate, okay? And therefore, it's not as helpful to use someone's chronological age to say how old they are. It's more a relationship between that person's chronological age and their level of function. You know, I would argue that probably Bobby Greenberg's physiological age is probably better than mine, just because of the incredible shape she's in. So let's try not to get stuck too much on age as a number, okay? And let's focus more on functional status and how that relates to the chronological age. If you want to get specific about it, the American College of Sports Medicine and the American Heart Association has classified everybody over the age of 65, or those between the ages of 50 and 65 who have clinically significant functional impairments to be considered, quote, older, right? So everybody over 65 or 50 to 65 if you have some other conditions. So this is ultimately what we want exercise to do. Okay, this is the bread and butter of why. And really it's to improve the chances of, quote, successful aging. And in my opinion, successful aging should be defined as increasing not only your lifespan, okay, but also increasing your health span. So how healthy are you in relationship to your chronological age? So if we look at this graph here, these are the same graphs. One's just by a guy I really like named Peter Attia, and then the others that kind of digitalized. So if you look here at this lifespan, so as we go along, right, our function capacity is inevitably going to drop as we age. So there's a curve that can be considered normal, and there's a curve that can be considered slowed or accelerated. And what you really want is not only do you want to push this curve out to where, you know, zero functional capacity is death, right? So you really want to push that out. So that's lifespan, but you want to do what's called square the curve, right? You don't want a nice, slow and steady decline. You want to maintain as long as you can and then drop quickly. So you're extending your lifespan, but you're also extending how long you are healthy and able to participate in a life that you enjoy. And that's what called squaring the curve is. So this curve here versus this curve here, this is more squared. You can see the rate of decline is much slower. And then the time spent in rapid decline is quite small, so that you really maximize you know, the effectiveness of your life, so to speak. Here's a silver lining. I love silver linings. It gives something to be hopeful for and to remain positive about. Exercise in an older population does not need to be as vigorous as it does in a younger population in order to reap benefits. So you don't need to go be Bobby Green and run Ironmans and marathons and swim 26 miles and stuff like that. You can just, you know, start out very slow and you start to affect this curve. You start to push it in the direction you want without having to dedicate 2, 3, 4 hours per day. Not saying that you shouldn't, but you don't have to, okay? Today, we're really gonna focus on the health span, and as a fact, increasing health span is going to increase your lifespan conversely. So let's talk about the effects of cardiovascular exercise, specifically on aging, okay? Coronary artery disease is the highest killer in America, right? So just to break down what coronary artery disease is, that's where there's plaque in the arteries that feed the muscle of your heart. So your heart is a muscle, and as it pumps blood, it requires blood flow, and that occurs through the coronary arteries. And cardiovascular exercise is the single most powerful form of exercise that you can do to improve your cardiovascular health, to improve the way your heart pushes blood to your body. And it's been shown reliably to decrease the morbidity, which is the disability associated with having a disease, the mortality, which is dying from a disease, the symptoms people feel, as well as rehospitalization. So should you have already had a hospitalization due to coronary artery disease, coronary heart disease, beginning a structured exercise program is the single best way to, over the long term, reduce your risk of rehospitalization due to that disease. Other really, you know, prominent diseases, high blood pressure, also known as hypertension, type 2 diabetes, high cholesterol, blood lipid disorders, cancers, cognitive decline, anxiety, depression, osteoporosis, falls, and many more. But these are by far the largest group of diseases that are common that cardiovascular exercise can improve. There's an asterisk next to cancer because it does not help all cancers, right? Some would say, if you're doing a lot of outdoor running, you're probably at a higher risk for skin cancer, and that's probably true. But skin cancer, other than melanoma, is largely not the fatal kind. So the cancers that best respond to exercise, colon cancer, breast cancer, and endometrial cancer, those three. And colon and breast cancer are very, very common causes of cancer. And so, just those two alone being affected by exercise is a great public health service. So things that it improves, just your level of cognition, your quality of life, because you can get up, move around, and interact more. The quality of your sleep, physical function, and maintenance of weight. Everybody knows it's harder to maintain your weight as we get older. Here, this picture is a Frenchman. His name is Robert Marchand. He's 104 years old, and he holds the world record for 1 hour of track cycling in people over the age of 100. Of note, he did not start biking until he was 67. So this is another example of it's not too late to start to exercise. It is very likely, that Robert here in this picture just has genetic gifts that would predispose him to a long life in general. But exercising starting at the age of 67, I hold the world record. It's very sure that he would not be able to hold that record should he have not exercised starting at 67. Okay, so how does specifically cardiovascular exercise affect these diseases, right? So it improves the heart muscle demand. The heart muscle demand improves the oxygen utilization, myoglobin in your muscles increase, the mitochondria in the muscles increase. A lot of big fancy words, okay? But let's put this, some of you might be looking like this, a little confused Arnold Schwarzenegger going, I don't know what the hell some of these words mean. But don't worry, I decoded it for you. So what it means is when you exercise, your heart gets better at pulling the oxygen out of your blood, okay, and using that to perform the exercise. In addition, that doesn't just occur in your heart, it also occurs in the muscles throughout the rest of your body. And that's what myoglobin is from the previous slide. And then the mitochondria are the tiny little powerhouses in your cell, right? So within every single cell of your body, you have something called a mitochondria that generates the energy needed to contract muscles, to make proteins, to copy DNA, to do all the work, okay? And the mitochondria makes that power. When you exercise, your density of mitochondria within your cells goes up. So your cells are able to produce more energy. Because of this, you can sustain higher intensity exercises for longer because you've got more powerhouses pumping up power. Then the arteries, the coronary arteries that feed your heart, have more blood flowing through them. And that's because of the slower heart rate. Every time your heart squeezes, you're actually not getting blood flow to your coronary arteries. It's when your heart relaxes that the blood flows into your coronary arteries and feeds the heart muscle. So a slower heart rate increases the amount of time that the heart is relaxing and increasing the amount of time the blood flows into the muscle of the heart. Then every time your heart squeezes, more blood comes out. So let's say you only, when you're sedentary, maybe only 30 or 40 cc's of blood come out of your heart. When you start exercising, 45, 50, 60 cc's of blood start to come out of your heart to your body and to your lungs every time your heart beats. That raises your good cholesterol and lowers your bad cholesterol. There are some quotations around that. For anyone who might have been my patient, my issues with terminology when it comes to calling HDL good and LDL bad. It lowers your blood pressure and reduces body fat. That's pretty self-explanatory. So let's talk about the risks of not exercising. Okay, this by far is one of the biggest issues in America. We all hear about the obesity epidemic. I would actually argue it's more of an obesity pandemic, as we see obesity and sedentary lifestyles really setting in around the world. And it's interesting, if you track the countries in which American commercial interests invade, it very, very shortly followed behind by these metabolic diseases, these sedentary lifestyles. So I would say the Americanization of the world is leading to a sedentary lifestyle all across the world. In 2013, a nationwide survey by American Academy of Family Physicians found that a third of adults reported no leisure time physical activity. And only 16% of the adults surveyed actually met the recommended guidelines, which we will go over in terms of activity levels. They stated that the barriers were just, they didn't know what to do, okay? They didn't have the motivation to do so, and that they already had poor health that precluded them from engaging in the exercises that were recommended to them. It's well known and we demonstrated that these sedentary behaviors are really strongly associated with poor glucose metabolism, which is blood sugar, and increased mortality. Our poor glucose metabolism, in my personal opinion, is probably the single largest problem that plagues America. And that is very closely related to the cardiovascular health that I refer to as the #1 killer, but really underlying is this poor glucose metabolism, right? How well do you use your energy to do the things you need to do? And we could go on a 3-hour lecture on that, but we won't dive into it. This here, I took notes on her, but I forgot to write it down. Let me check. If I recall correctly, in the picture on the left, she's mid-60s, and the picture on her right, she's 73. So in 8 years, she not only, transformed completely, but if you just look at her, she even looks younger in the picture on the right, even though she's 7 or 8 years older. You could Google her, you can just Google senior athlete transformation and she'll pop up. I meant to take notes, but apparently I didn't write it down. I apologize. So really, everyone hears about ADD, right? Attention deficit disorder in adolescents and young people, but EDD, or exercise deficiency disorder, I think really plagues the older population much more so. Here's a picture of Vin Diesel, right? He's a movie star. This is what 2 weeks of binging and not exercising looks like after you've been in phenomenal shape. So the picture on the left there is him in Fast and Furious 4, and then he was caught on a balcony a little while later, 2 weeks later on vacation. And you see smoking a cigarette, big old fat gut. Who knows what he's been doing for 2 weeks? But anyways, so exercise deficient disorder, overall, it can be accounted to result in a large proportion of falls. There's 250,000 falls a year. Obviously, obesity and overweight is a large problem in America. We went over coronary artery disease, heart attacks, blood pressure, diabetes. We went over all that. Let's see. So those are all the risks of not exercising, right? If you don't exercise, you're much more likely to get all those things. Those things are likely going to become out of control and fail intervention if exercise is at least some part of the fix for those problems. Let's talk about the risks of exercising. No study that I have seen have I ever heard of ever shows that the risks of exercising outweigh the benefits. It's the other way around. The benefits of exercising greatly outweigh the risks of exercise. And let's not fool each other. There are risks. If you go outside, right, and you're running around, or you're on a bike, or you go trail hiking, you have a risk of slipping and falling and hurting yourself, right? You have a risk of, pushing a weight too much and maybe injuring a tendon or something like that. So there are risks, okay, but all those really pale in comparison to the benefits. If you have a question on whether or not you should start to exercise, you can answer these simple 6 questions here listed. And this is called the Easy Tool. You can also Google it. If there's a yes to any of these questions, I encourage you to talk to a healthcare professional to get advice on how to start your exercise regimen and start your quote transformation. Let's see. Some absolute do not pass go, do not collect $200, do not start exercising rules, okay? If you have had a heart attack, otherwise known as a myocardial infarction, within the past 6 months, do not start cardiovascular exercise until you are cleared. So by your provider, preferably a cardiologist, after testing has been done, such as stress tests, cardiac imaging, catheterizations, things like that. Do not do that. That is a very dangerous thing. If you have angina, whatever you want to call it, or active symptoms of congestive heart failure, those things need to be controlled before you start a regimented cardiovascular exercise program. If you have a blood pressure greater than 200 over 110, do not start exercise and seek care immediately. Blood exercising of all forms, okay, increases your blood pressure during the exercise. Now, if you have a normal, healthy blood pressure and you have some increase, it's not that big a deal. But if you have, dangerously elevated blood pressure already, and then you go exercise, you really risk rupturing a blood vessel somewhere, in particular the brain, which would cause a devastating stroke. So it is important to know your blood pressure. It's important to know your medical conditions, and it's important that you have any questions whatsoever that you consult with a physician or another healthcare provider before you start a structured exercise program. Okay, let's get into actually what to do here. That's enough hobnobbing about why and the red flags. So if you're currently inactive, okay, the number one rule is stop being inactive, right? Do anything to reduce your sedentary behaviors, right? And any movement whatsoever is better than no movement at all. So I don't care if it means that during commercials, you get up and you do 2-3 laps around the couch and then you sit back down and keep binge watching your Netflix. I don't care. What it means is to stop the sedentary behavior. Another good trick is that, listen, you don't need to set aside, 20, 30, 40 minutes, an hour every single day continuously. You can go out and do them intermittently. So if you don't want to go out when it's a little chilly in the morning, you just want to do 2 or 3 walks in the afternoon. Like I said, if there isn't a show on TV you like at the moment or something like that, and you go out, just go out and get your time in. It doesn't have to be continuous. I think it's funny. This graph here is really meant to, where's my pointer here? There, over here, is really meant to emphasize that technology largely has made us quite sedentary. And, sitting on the couch, iPads, on the phone, watching TV, those things really encourage the sedentary behavior. I would advise people to get, if they really want their technology, to get mobile with their technology, right? To put it on the treadmill or put it on the elliptical or get earbuds and go for a walk and listen to your podcast. You can still enjoy the media content that you want via your technology, but make sure it's mobile. Make sure you can move with it so that you're not tied down. It's also important to make sure that you choose risks if you're deciding to start physical activity that don't pose injury, right? We want the maximum benefit for the least amount of risk. So it's very safe exercises, right? Just brisk walking, swimming, as long as you don't have to swim, I suppose. Water aerobics are fantastic, especially with anybody with joint pains or orthopedic concerns. Golfing is a big thing. I love golfing. I still think it's a cart though. If you want to golf for exercise, I encourage you to go no cart, right? You don't necessarily have to carry your bag. You can have the cart that you can push your bag along. So you don't necessarily have to carry, although that would certainly increase the vigorousness. Is that a word? The vigorousness of the exercise. Bicycling is also extremely good, especially for people who have hip and knee osteoarthritis. People find bicycling to be very tolerable and can really get their cardiovascular exercise in, as well as because you can go at an increased pace, you can see a lot of sights. You can cover a lot of ground. You can go a lot of cool places on your bike. And then other cardio equipment, treadmills, stair steppers, elliptical machines, rowing machines. The hand ergometer, stuff like that. Anything to get the heart rate up. The goal for anybody who is inactive, trying to become active, is 150 minutes per week of what's called moderate intensity exercise. And so moderate is defined by the American Heart Association as anything 3 to 5.9 METs, okay? And what is a MET? A MET is a metabolic equivalent of task. That's what MET stands for. And basically sitting here doing nothing is 1 MET, okay? Now, if you are exerting yourself and you're exerting yourself at 3 times the rate of resting, okay, that's 3 METs. Okay, or 5.9 is 5.9 times the metabolism it takes to just sit here and do nothing. So a way to know where you are in your quote MET is to monitor how you feel, right? So if you're breathing harder, okay, and you can feel your heart rate going faster, if you can feel your breathing starting to pick up, that's when you're getting into the 3 to 5.9 METs. You should be able to talk to somebody, but you should not be able to start singing a song. And if you were to grade the level of exertion on a 10-point scale, you would say, you know, I'm working somewhere between 5 and 6 out of 10, compared to as hard as I could work being 10 and doing absolutely no work being a 0. We've all heard of the food pyramid. There is an exercise pyramid, right? And if you look at the foundation of this pyramid, you really see that there are things that can generate activity that can be done every single day and that are considered cardiovascular exercise. Take the stairs instead of going up the elevator. You know, go out there, tend your garden every day. Vacuuming, mopping, sweeping, when those things are done continuously without breaks, that's considered cardiovascular exercise. So even cleaning your house, you can count as eliminating the sedentary behavior and beginning the exercise. Then as we go up the pyramid, I recommend everybody at least get to this level, okay, where 3 to 5 times per week that they're doing purposeful exercise. And then I'd really like, as we go on, for everybody to get into zone 2, but we'll cover that in a moment. I am going to take this opportunity to talk about sex as a cardiovascular exercise. It absolutely is, okay? It is considered a moderate, so a 3 to 5.9 MET activity. But as you've heard on commercials, right, sexual activity is not safe for everybody. So once again, if you answered yes to any of those 6 questions earlier, you know, and you're interested in engaging with your partner on a regular basis in order to get your cardiovascular exercise in, I'm all for it. Just make sure it's safe and make sure that you've at least answered no to all those questions I put up there earlier. Okay, so it's important when starting something new to really develop the goal, the tactics, and the strategies. Okay, so you really want to define the end goal, but the end goal can be rather robust and sometimes intimidating. And therefore, it's very helpful to break down the goal into very small and achievable milestones. So if you're inactive currently and you say, hey, I want to do a 5K by, let's say, the end of summer, okay? Well, then it would be important to have not only monthly goals, but also weekly goals, right? So a weekly goal could be start as, I'm going to do 10 minutes of walking twice per day, and that'll be for several weeks. And then it'll go to 20 minutes. And then the next month it'll be I jog half of it. And you increase like in that manner to where you're maintaining your progress. These things don't change overnight and they take some diligence, but they do change. Our body is remarkable at being able to adapt physiologically and being able to achieve the things we ask of it. It's important to set a schedule, right? So it's that, write it down, put it up on your bathroom mirror, on your fridge, and make sure that there are reminders there to interrupt the sedentary behaviors that have become dominant if you don't currently exercise. You need to eliminate the barriers and the quote excuses, okay, that I can't exercise or that I can't be active. You need to interact with people who have similar goals to you, or perhaps seek the advice of a colleague who is active that you wish to be as active as and get their advice on the matter. You can, find ways to become active that don't aggravate any chronic medical conditions that you have. So there really is no excuse or reason I found that somebody can't exercise. Even in those that I talked about earlier, those 3 rules that you should absolutely not start exercising, the blood pressure, the chest pain, heart failure, myocardial infarction. There are actually exercises for those populations, but they are physician supervised in a physical therapy office and stuff like that. So even those people do get to exercise, okay, but they should not do it on their own. There is literally no reason not to exercise. I can't think of one. And if someone has a question about if they think they have one, I'd be happy to talk to you. But there really is no reason. I haven't found one. The next, you should reward yourself, okay? If you're making a change, you're making a positive change, you deserve to be rewarded for that change. And you can reward yourself. I always encourage to reward yourself with something that once again reinforces the goal. So for example, if you've started to walk, right? And you're starting to do good on your walking program, reward yourself with a nice new pair of walking shoes, or reward yourself with a small vacation somewhere to a picturesque destination to take a walk on a beach or something. To reward yourself with a self-fulfilling reward that feeds the goal again. I personally am rather guilty of rewarding myself with something that doesn't always help the goal, like going to get an In-N-Out cheeseburger or something like that. If you do choose to do that, that's okay. Moderation is important, but don't let it kick you off your goal, off your track. Okay, so let's talk about how to really step up your game, all right? If you are currently doing cardiovascular exercise and you would like to be better at it, and you really want to optimize the way your body generates energy for exercise, you want to optimize the way your muscles and your heart access the oxygen in your blood and your fat and your blood sugar, and you really want to turn it up, you need to start doing more intermittent vigorous exercises, as well as something called zone 2 exercise. And we're going to go over that right now. So if you are currently exercising and everything's going okay, that's fantastic. But if we're going to start vigorous exercise training, I do recommend you consult with your healthcare provider before really starting to push the intensity. Things can happen at maximum effort that don't happen at lower effort exercise. So I do encourage to follow up with your healthcare provider before doing vigorous activity. So vigorous activity 1 to 2 times per week, excuse me, for just 20 minutes is all that's needed to start to push your capability to exercise at a high intensity. Excuse me. Examples of vigorous things are high intensity interval training, or HIIT, CrossFit. You might have heard of Tabata classes, interval training. And Tabata's intense, man. I'd be happy to talk with anybody about Tabata. I can't do it. Anyways, moving on. So you can think of those things as the peak of the pyramid, okay? And what you want is, everybody wants a big pyramid, right? Everybody wants a pyramid to be nice and tall and stand high, and everybody look at my pyramid, right? But I would encourage you to think about this structurally. If you want a nice, big, tall pyramid, what do you need? You need a big, wide base, okay? And the base of the pyramid, you're going to build by doing something called zone 2 training. Zone 2 training is a level of exertion, okay, that preferentially uses your body's fat as the fuel for the exercise, okay? So while you're doing a zone 2 exercise, your body is using almost entirely fat to create the energy in the mitochondria that we talked about, that then allow your muscles to pump, your heart to move the blood, your muscles to squeeze, right? All that. And what happens is you can train this zone. And as you train this zone, it gets better and better and better. The reason why it's important is because every single one of us, even if somebody in this crowd only has maybe 9 or 10% body fat, excuse me, every single one of us has tens of thousands of calories stored in their fat in their body. And that's why people could do ultra endurance races, because they just keep pulling from fat, because everybody has many, many, many thousands of calories just waiting to be accessed. But you have to train at a certain level in order to preferentially access it. When you start to increase the intensity of the exercise, you start to rely more on carbohydrates or sugars. And that is a very limited supply. If anybody has ever bonked, okay, where they're running along and all of a sudden they, quote, hit the wall, what you're doing is you are hitting the end of your blood sugar supply, and you can no longer fuel your body, and you are forced physiologically to stop exercising. And that's because the exercise intensity goes too high, and they start needing sugar instead of fat to fuel the rate of energy consumption. And that's what this graph essentially shows. So we're going to break down this graph here. Moving from left to right is the level of exertion. Okay, so as you go from left to right, this person is working harder and harder and harder and harder. You can see early on, this blue line goes up nice and high. And what this blue line is the amount of fat somebody is using to generate the energy for that exercise. The red line is the lactate. Lactate is a byproduct of using sugar or carbohydrates to generate energy. You can see as it goes up, the rate of fat oxidation using fat for exercise just precipitously drops off, and vice versa, sugar starts jumping up. So if we want to be able to exercise, we want to use our fat, we need to stay somewhere right in here, because as soon as we start to go out this way, we start to, one, use more sugar, right? And the clock starts ticking on how long you can exercise, as well as we're losing fat. And once again, the clock starts ticking on how long you can exercise. So between, I'm very sorry, everybody. So between this point and this point is called your zone 2, okay? And your zone 2 is trainable. As you do this type of exercise, you will find that you can run faster or bike harder or swim longer. You can exercise at a higher intensity without having any need to utilize your blood sugar. And therefore, that's the base of your pyramid. The wider you build your zone 2, as you increase the intensity of exercises to maximal intensity, you're going to need less and less sugar because your base of fat utilization is so wide. Does that make sense to everybody? I know I'm kind of beating that home, but it's super important to understand. In order to start to, quote, move the needle, right? In order to start to build your base of cardiovascular exercise to improve, you need at least 3 hours of zone 2 training per week, okay? Now, this is the advice for everybody. I have not been able to find any information that this is different for an older population or a younger population. In general, like we talked about earlier, an older population typically doesn't need as large a stimulus as a younger population does. So 3 hours is a great goal to go for of zone 2 training per week. If you only can do an hour or two, then that's fine. You're still getting some benefits, but don't expect a large acceleration in like your race pace or anything like that if you're doing any competitive exercising. Let's see. So how do I know what my zone 2 is? Okay. Zone 2 can also be called low heart rate training. And it's defined as 60 to 70% of your maximum heart rate, right? Okay, well, the question still remains, well, what the heck is my maximum heart rate? There's a couple ways to go about doing this. I would say antiquated way of figuring this out is you take 220 and you minus your chronological age. And we already talked about previously, I'm not a huge fan of chronological age as determining someone's functionality. A more recently proposed but not yet validated strategy is to take 207 and you minus 70% your age. You can do a field test where you get a heart rate monitor and you go out and you run up a hill a bunch of times and you see how high can you get your heart rate, and you call that your heart rate, your maximum heart rate, and then you train at 60 to 70% of that for your zone 2. In order to do zone 2 training, I really recommend a heart rate monitor. You can get really fancy. You know, they make all different kinds of these chest straps and arm straps and Apple Watches and the Whoops and the rings and all kinds of really cool technology that can help you track your heart rate. But you don't need to spend a bunch of money, okay? If you just go on Amazon or Google or Walmart or somewhere, you can pick up a heart rate monitor for well under $100. You can even use the heart rate monitors on the treadmills, the little grip things on the treadmills, the ellipticals, you know, those are fine too. I really do suggest a heart rate monitor in order to make sure you're staying in the zone. The other option, sorry, I think I might have misplaced a slide here. Yeah, sorry, I put these slightly out of order. The other way to determine your zone 2 is to do a Vo2 test. If anyone's ever heard of a Vo2 test, this is me doing one. So I've got this tube, you know, in my mouth. I got a nose plug on, and I'm on a treadmill set at a defined rate and a defined incline, and I'm just ticking along. And what they're doing is they're measuring the amount of oxygen and CO2 coming in and out of my mouth. And that can tell us, am I burning sugar or am I burning fat? So this is an option. You know, I'm at UNLV's Sport Research Institute lab here. The other is you can do what's called blood lactate. They make finger pricks, like little test strips, very similar to blood sugar, but they test lactate. And what you're looking for is you're looking for your lactate in between this range, from when you go to 0.7 to under 2. So you want to be in this range. So if you're pricking your finger and testing your blood lactate, your goal is an exertion level that gets you to 1.6 to 1.9, somewhere in there. My preferred technique, and this is just me speaking, Apple does not give me any money. If anybody here knows anybody from Apple and they would like to give me some money, I will take it. But this is what I use. I got mine right here. I use Apple Watch. The Series 4 or newer really is the one that I recommend. Series 3 doesn't analyze your gait. Series 4 and Series 6 does. And analyzing the gait can be very helpful in injury prevention once you can make sure you're getting the benefits of exercise and none of the harms. Everybody, when they're running, should have at least a cadence of 160 strides per minute, okay? I'm a pretty tall dude, and my goal cadence is 165. So maybe if you're 6'5", 6'6", 6'7", maybe it can be a bit slower, but in general, everyone's cadence should be above 160. And that's why I recommend the 4 and the 6 series, because cadence is only available on that series. Your goal is that you're trying to maintain a heart rate plus or minus 5 of your ideal zone 2. And as you're running along, you can take a look at your running, biking, swimming, whatever. You can take a look at your heart rate monitor and adjust your level of exertion to make sure you're staying in that target heart rate zone. This is just an example of what a readout looks like on an Apple Watch. Let's see. So I've been babbling on for a while. Let's break down some medications real quick to know that what you might be up against if you are currently on medications, okay? ACEs and ARBs, right? So these are the things that end in pril or sartan, valsartan, lisinopril are very common ones. They're great for treating blood pressure, and they're generally pretty safe with exercise. So these are the ones we go to first, okay, if someone's battling high blood pressure and they want to exercise. There is a minimal increased risk in dehydration. So, you know, I always encourage people to hydrate regardless, but should you be on this medicine, up it a little bit more, maybe add some electrolytes in there. Diuretics, okay, so hydrochlorothiazide, chlorothiazide, Lasix, furosemide, spironolactone, Bumex, all the diuretics, especially because we live in a very hot environment. These really you need to be careful with these. They can really increase the risk for dehydration-related exercise illness, such as passing out, heat cramping, sometimes even muscle breakdown due to dehydration. A tip: if you are on these medicines, talk to your physician, and if you do decide to continue to exercise while on these medicines, after you're done exercising, don't stand still. You're very likely to pass out. So like at the end of a marathon, you're running and running and you stop, don't just stand there. Like walk in circles a little bit and do a little bit of an active cool down, because it's very likely that you're going to at least have a temporary drop in blood flow to your brain if you rapidly stop exercise, and that's more likely to happen on diuretics. Beta blockers, metoprolol, carvedilol, atenolol, propanolol, all the lols, the LOLs, are your beta blockers. So these work therapeutically by decreasing the heart rate and the cardiac output. So they're very commonly used for heart failure, right? Where we don't want to task the heart too much. However, if using these medicines, it can also result in decreased peak exercise ability, as well as a decrease in the endurance of cardiovascular exercise. Because they blunt the response of the heart to a stimulus, if you're changing positions, such as from lying down to standing up, you can get dizzy, or what we call postural hypotension, or a postural change leading to low blood pressure. In addition, if anyone here is insulin dependent, type 1 or type 2, it can sometimes mask low blood sugars. And once again, do not stop these medications in particular without talking to your heart doctor or your other healthcare professional. And stopping these medicines, if appropriately prescribed and being used for an underlying condition, that can lead to some pretty bad stuff. So please talk to your doctor. Calcium channel blockers, such as amlodipine is a pretty common one. I'm forgetting my calcium channel blockers right now. And nitrates, such as nitroglycerin, the tablets people take for angina. They can impair the blood output from the heart, but conversely, they improve the blood flow to the heart. So it's kind of a give and a take. Now, I'm personally not a fan of stopping someone's calcium channel blockers or nitroglycerin if they find it useful and they tolerate the side effects at rest. As far as anti-inflammatories, over-the-counter anti-inflammatories, this is Motrin, Advil, meloxicam, Mobic, diclofenac, indomethacin, those kind of things. It's important to understand that those have the side effect of elevating a blood pressure, so making sure you're checking that. Cause fluid retention. They can be detrimental to the kidneys if taken at high doses or long-term. It can really irritate people's stomachs, increase the stomach acid, cause ulcers in people's stomachs. Do not use NSAIDs if you're on Coumadin or warfarin or other blood thinners, particularly Coumadin and warfarin, less so for the newer oral anticoagulants. And then any central nervous system acting agents, such as benzodiazepines. I am the biggest hater of this medicine right here, Ambien. Man, I don't like this stuff. It's bad stuff. If you currently take Ambien, for sleep, I highly recommend considering exercise, as an exercise can largely replace the need for Ambien in conjunction with some other cognitive behavioral interventions. Oftentimes, other centrally acting medicines, such as antidepressants, they could be replaced by exercise. Exercise feels good, it increases natural endorphins, and is a very strong antidepressant. So oftentimes, some of these central acting medicines aren't even needed once you start to implement a regular cardiovascular exercise program. As far as medicines that control glycemic index, such as your blood sugar levels, if you're insulin dependent, please talk to your doctor about putting in a plan to make sure that your exercise does not cause you to drop too low. There are things that can be done, and this is not a reason not to exercise. Metformin is a medicine that's used for type 2 diabetes. It is safe with exercise. It may interact with your zone 2 a little bit, but that's a rabbit hole we're not going to go down at this time. So all in all, get out there and exercise. If anybody needs any help in questions about, how to go about it, how to do it safely, questions on the medicines, questions on, intensity levels, anything like that, I'm always super happy to help. Here's my contact information. If anyone would like to get in contact with me at my clinic, you can give us a call anytime. I'm currently out on paternity leave for the remainder of this week. And then I'm back part-time in my clinic for the remaining 6 weeks. So up to the first 2 weeks of April. But, you know, still taking new patients. I do both in office as well as telemed appointments. Call us, leave us a message. If you'd like to know more about our clinic and what we offer, you can visit our website attached there. And 51 minutes long, so we got some time for some questions. Sharon's got her hand up.
Yeah. Should you be varying the types of exercises that you're doing? Should
Absolutely.
you be?
Absolutely. So the goal is to increase the breathing and increase the heart rate. And whatever way you do, that's totally fine. You know, spring is in the air. If you were to mop your house for an hour, there's your exercise for the day. You know, I do encourage varying the type of exercise, and it's not necessarily for the cardiovascular benefits, but more of the musculoskeletal benefits, right? You can get into overuse injuries. You know, a very common one is people who swim commonly get an impingement in the shoulder from a lot of overhead reaching. And so making sure that you can rest your shoulder and maybe do some bicycling, right? Or do some jogging or stuff like that can help rest things that have been used so that they can recover and come back stronger for the next round. The muscles and the tendons, let me back up. Muscles require rest, okay? So you need to exercise the muscle, let it rest, let it recover so it can rebuild stronger, and then you can tax it again the next time at an increased workload. And doing that consecutively results in the benefit. Ligaments and tendons, while they should be rested from intense exercise, they can be stretched daily, right? So making sure that you're doing daily range of motion and flexibility exercises, that's something that you can do daily.
Okay, thank you.
You're welcome. Dolly's got her hand up. Sorry, Mary.
Okay, I had to unmute myself. A quick question is, my husband wears he has a pacemaker for his heart. And he has a pacemaker defibrillator.
Okay.
For his heart.
Yeah.
And my question is this: can he wear an Apple Watch, or is there any conflict?
I do not know of a conflict. I do believe Apple Watches are safe to wear with an AICD. The next question is it the device in his chest? Is it an AICD, an automated internal cardiac defibrillator, or is it actively pacing him at all times? Yeah.
No, it doesn't actively pace him at all times. It's the AICD.
Okay, so, and that's important because there are devices that pace people's hearts. Like it's set to a pace and that's your heart rate and that's it. And then also defibrillates, or the old rub the paddles together and shock somebody. That's called defibrillating somebody. I can only think of maybe a handful of patients I've taken care of in my career so far where they are paced. Almost everybody, they let the heart do the job, okay? And then the device is there to monitor, and should an event happen, it defibrillates them.
Right.
So
that is his situation.
Yeah.
I just wonder, because I'd like to get him an Apple Watch, but I didn't know if I know they can't use anything that has magnets, and I didn't know if I've researched it, but I haven't been able to find out.
So on the back of the Apple Watch, okay, these little things emit light, and that's it. Okay, there's no electrical current going through the patient when they wear this watch. Now, you can add features, okay, to the watch, and there are features on the watch in which you can obtain like a little EKG basically on yourself. But even then, that's safe as well. I'm sure your husband has gone to a doctor's office and gotten an EKG with his defibrillator in his chest, right?
Yes.
So it's totally safe. It's not a concern. Yeah. I could keep going down the rabbit hole, but go for it. All right. What's up, Mary?
Can you talk a little bit about what you did to help me? Because I find a lot of people do not understand the importance of stretching, and that if you're experiencing pain, not necessarily just during a exercise, but perhaps even after, like I was, and it wasn't going anywhere, and I was given exercises to do by 4 different physical therapists. And what you were able to uncover for me was that some of the exercises were not beneficial and may have been contributing to the pain, and that the lack of stretching, and that's kind of what got me out of that pain cycle.
Yeah. So your situation, unfortunately, is not a rare one. People love to exercise, okay? Exercising feels good. Using the muscles to contract, to move weight, you feel the blood flow increase. You feel good when you beat a resistance, right? When you're pushing against something and you win, it feels good, okay? But oftentimes, that is what people hone in on, and they totally forget the other half of the equation, okay? The secret to exercise, okay, is recovery. Without recovering, okay, you will ultimately, in every situation, undergo an injury because you overworked something, okay? And recovery is the other side of the exercise coin. So one is the actual exercise itself, and the other side is the recovery. Recovery needs to include training in flexibility and stability. If you do not have a healthy range of motion, everything else will fall by the wayside. Nothing else will work. So establishing a healthy range of motion, building in stability and strength within that range of motion is the way to break the cycle of pain due to an orthopedic issue. So in your case, Mary, you know, you were very, how do we say it? I don't want to give away your health history, but you had muscular imbalances, right? So, you know, one thing was pulling too hard one way and one thing wasn't relaxed, right? So you were kind of folding, if you will, right? You need to get back straight. And the way to do that is to stop exercising the stuff in the front that's bending you forward and start stretching that out, and start exercising stuff in the back to help you stretch back out, right? So it's really a customized prescription for someone's individual problem, and identifying and finding a balance in those situations can break the cycle of pain due to a musculoskeletal injury. Did that answer your question?
Yeah, and I find that most people overwork their quads because it's just a normal thing. Everything we do works the quads, but then they don't do anything to work the hamstrings. And so you have this incredible muscular imbalance. And that was a big thing with me. But until you showed me, you know, basically you need to do these stretches, and you need to, because I basically had really tight hamstrings, and I had overworked quads just like everybody else. But yeah, it's been a big help, made a big difference. 4 years of pain, and all of a sudden 3 visits or 4 visits or whatever, and I'm out of pain. Now I still need a hip replacement. We know that. But
yeah, you're such a soldier, you know. The hip replacement should be reserved for people who just can't do something because of the pain. And that's not you.
Yeah, well, and you know, I'll get there at some point someday, but the longer I wait, according to both you and the surgeon, the longer I wait, the better off I'm going to be as technology keeps moving and as I'm strong. So when I go into surgery, my recovery time is going to be less. So I think that's one benefit of exercise. And a lot of people do prehab instead of rehab.
Yeah.
And that's what your exercise program is really doing, is it's creating that prehab so that if you do have to go in and have surgery, you're much better off coming out on the other side.
Absolutely. Yeah.
Thanks.
No. Any more questions? All right. Well, I hope this was informative. I hope I didn't lose anybody. Like I said, if you have any questions, please get in contact with me. I'm happy to help in any way I can.
Thank you so much, Dr. Barnes. That was great.
All right, guys. Well, I'm going outside. I'm tired of being inside. Beautiful.
Sounds like a good plan.
Hope to see you guys out there.
Thank you.
All right. Bye.
Bye.